Hi, my name is Ari Cohen, and today I'm going to be discussing my study called English and ASL and Autism Spectrum Disorder. To let you know, I will be following a PowerPoint along the way, which will get submitted with the video. So first, to talk about the background. First, autism spectrum disorder. As its name says, the spectrum disorder means that there is various severities amongst the individuals and their symptoms. So we could see 20 to 30% of our population of ASD with no functional language, and then really high functioning individuals which can communicate with others, with peers, their teachers, in society. Another thing is that it's a lifelong disorder. There is not one particular cure or treatment that we can use, similar to a lot of the other disorders that we discussed. And there's not one specific genetic underpinning right now that researchers can identify. So researchers are generally looking at endophenotypes instead to sort of nail down that genetic underpinning. And lastly, there is a pragmatic language impairment in these individuals. Again, the severity will differ amongst individuals, but essentially they have difficulty communicating in social contexts. Now to talk about American Sign Language. First and foremost, it is a real language, and I think there's a lot of misconceptions in society about whether or not it counts as a real language or not, but the truth is that we see similar developmental patterns in acquisition as we see in oral language in typically developing children. And another thing is that it's commonly taught to deaf children or deaf individuals and their families. You won't necessarily see a hearing person or someone who belongs to a hearing family know sign language because it belongs to this niche community. And unless they seek it out on their own, they're not really going to learn it in everyday life. And the last thing is that there are non-manual markers to convey meaning, such as place of articulation and facial expression. For example, anything related to girl or female will be on the lower half of the face, where a guy or female will be the top half of the face. For example, we have girl and mother, and then boy and father. Next, I'm going to go over my hypothesis. What I say is that ASD children beginning to learn ASL at age 5 will not be able to acquire fully proficient sign language by the age of 12. Because ASD individuals have this characteristic pragmatic language impairment, and because ASL requires the register of facial expression, which could be difficult for ASD individuals, I don't believe that the individuals with ASD will be able to utilize that language and grasp it entirely by the age of 12. What are the methods? So first, the participants are going to be 5-year-old children with an ASD diagnosis, and they have to have the diagnosis for the Center for Autism and Related Disorders in order to control for diagnostic criterion. I will recruit 30 different children. 15 will go into the high-functioning ASL group, and 15 will go into the standard English group. The standard English group from ages 5 to 12 will just receive English input as they normally would. This is the control group. The 15 in the ASL group will receive that English input as their control peers will be. However, their parents will be giving them ASL input at home, and those parents will receive training ahead of time before the research begins on ASL. And lastly, to describe high functioning, that will be defined by the Center for Autism and Related Disorders. Essentially what we would look at is we would ensure that all the individuals recruited for the study have a generally high pragmatic language ability. The assessments used. We will administer all assessments at the Northwestern Neurodevelopmental Disabilities Clinic, and that's with Professor Losh. We will have annual check-ins starting at age 5 and every single year up until age 12. And we will use 2 different assessments for both groups. The first is the Sign Language Proficiency Interview, SLPI, which is a one-to-one interview between the interviewer and the interviewee, which is the child. And it just looks at content, and there are different categories such as vocabulary production, fluency, and comprehension skills that are looked at in these interviews and in this assessment. The second assessment is the comprehensive assessment of spoken language, which is CASL. This looks at 4 different categories: lexical, semantic, syntactic, supralinguistic, and pragmatic in individuals. And so that will sort of look at the oral language in both groups. Anticipated results. The general trends I expect to see is that high-functioning ASL will improve their English over time. Now, they're going to be receiving 2 different sets of input, so I don't think it will improve remarkably like the other group. However, I do expect their English to improve. And also, we expect to see considerable ASL acquisition. Because they're receiving input from ages 5 to 12, they should acquire something over that time period. And one article by Edward G. Carr said these individuals are generally going to learn nouns first, similar to oral language, and requesting things should be one of the first things that they acquire as well. But what they will have difficulty with is generative and creative aspects of language, and that's why I don't believe that they will have that full proficient language by age 12. The high-functioning standard English group I also suspect to have improvement in their English over time, and in fact better than the ASL group because they will have just one set of input the entire time. And again, they will not have ASL acquisition because they're not receiving input. So to sort of just echo myself, the why. So you can't learn language without input or exposure, and we've learned that in class. So again, these individuals in the standard English group are not going to acquire ASL due to the fact that they don't receive any input. And then English proficiency should improve more in the standard English group. And I touched on this before because they don't have the conflicting input. They're not processing two languages at once over that time. They're only looking at English from that 7-year period from 5 to 12. The next slide in my presentation is going to go over the graphic that I've created that sort of just illustrates those trends I described. And the discussion. ASL proficiency depends on an individual's functioning. I only recruited high-functioning individuals because I knew that low-functioning individuals with really, really high pragmatic impairment would not be able to understand those non-manual markers. So again, the functioning will really affect whether or not they're able to pick up the language. The start age. If we start language learning earlier, it's more likely that they're able to acquire more and become more proficient, and we already know this. The problem is that our age of diagnosis for ASD is at about 5 to 6 years old, so if we can push that diagnosis earlier, it may be easier to teach ASL to those kids at a younger age. And lastly, input and opportunity. So high input and high quality input and exposure to these children in any particular language is more beneficial, and their opportunities to practice them is also a huge part of that. Why use a longitudinal design? Well, in order to understand acquisition and development and whether or not it's feasible for these individuals to acquire the language, we have to look at their progress over time. It's going to be really hard to look at language and proficiency at one snapshot in time as opposed to year-by-year progress. And lastly, what is better for ASD, Standard English or ASL? It's hard to say. We only gave them input at home from their parents, so we didn't give them full-on exposure and input, so it's hard to say whether or not the proficiency would eventually have been acquired or not. Another thing is that the severity of the pragmatics impairment needs to be looked at as well. If they're really low functioning in terms of pragmatics, it's going to be impossible for them to learn ASL. And lastly, we have to look at this isolation factor, which we saw in Sound and Fury. Do we want these individuals to belong to a very niche culture that isn't really involved in the rest of the community? Thank you.